Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Kristen Casey. She's a clinical psychologist, and today's KevinMD article is titled, Patients with Chest Numbness Following Mastectomy May Experience Lower Quality of Life. Kristen, welcome to the show.
Thank you so much for having me.
So we'll get into your article in a little bit. First off, briefly share your story and journey.
Sure. I'm a clinical psychologist, former emergency medical technician. I've worked in a variety of settings: inpatient, outpatient, primary care, residential, and hospitals. And I'm mostly focused on health and medical psychology, helping clients navigate really tough medical diagnoses or really helping them regain their sense of quality of life after maybe treatments that they've had.
So tell us about your role as a clinical psychologist for these patients who are undergoing difficult medical journeys.
Yeah. So, with any big, heavy medical diagnosis, there's, shock. There's, how am I going to work through the rest of my life with this? How am I going to find my place in the world? So a lot of it is deconstructing what your ideal life might be like, because life will look different after certain medical procedures. A lot of times I'm there as a support system for them if they don't have support. And a lot of times we could teach clients how to look at themselves in the world in ways that are more ideal for their situations. Because when you're going, as when you're going through something really hard, especially when it comes to a medical diagnosis, things feel pretty bleak. So we really try to focus on enhancing quality of life.
So what are some common techniques that you would use in these situations?
Yeah, so it depends on the diagnosis, of course, but I've worked with a lot of people who have experienced, cancer diagnoses or diabetes diagnoses, or really a diagnosis that they weren't expecting. And a lot of times we do a lot of process. Clinical psychologists, we have the privilege and opportunity to get to know the depths of people's minds, which I think is pretty amazing. We learn their biggest fears, their biggest doubts, and based on those fears and doubts, we could kind of navigate treatment in a certain way. A lot of times it is really coming to an acceptance phase rather than agreeing with the situation. And a lot of it will be stress management techniques, like how do I deal with, anxiety relating to my next medical procedure, or how do I manage my stress and telling my family about all of this? So we really spend a lot of time of really getting down to what is the client's deepest fear. And every client will have different fears.
All right, let's talk about your KevinMD article titled, Patients with Chest Numbness Following Mastectomy May Experience Lower Quality of Life. Tell us, how did this article come together?
Yeah, I'm so passionate about this topic. So I wanted to learn more about what my patients were going through on the physical side of things. As clinical psychologists, we work with emotions, brain, and psychology. So we focus a lot on the emotions. But as I was learning more about what my clients were dealing with post-mastectomy, I noticed that a lot of them were really worried and really anxious about the fact that the way that their body feels, the way that they navigate the world, and the way that they find their place in their own life is kind of disorienting for them. So as I was looking, I was really looking for answers, to be honest with you. I was like, is there any way to regain sensation post-mastectomy? And I came across Dr. Larson. He's a breast surgical oncologist with New York Breast Health, and he's so kind and helpful, and he really helped me understand the nature of what happens post-mastectomy. And a lot of times we don't realize, especially as, psychologists, because we're just not medical professionals, we don't realize that, sensation might be lost or limited after mastectomy. And if you think about sensation, it's so important. It's, how we navigate the world and how we assess for danger and stuff like that. So that's how it came about, and that's how it started.
So when patients post-mastectomy come to you, like, how do they normally present? Do they present with these changes in sensation like Dr. Larson articulated? Like, how do they come to you?
It's so interesting, Kevin. So when I normally see clients, and I still have a couple, I've had several former clients, and then when I worked in the hospital, I had quite a few. They will come to me and say, I feel empty, I feel different, I just kind of feel this sense of loss of identity. And when we really get down to it, when we think about sensation, it was something that I hadn't even considered either. I just hadn't considered that sensation would be a navigating point for clients. And if you think about receiving a hug, or for women, holding your newborn, you lose that sensation and you lose that connection point. And it was really, how do we navigate this new experience for you? But really what we're getting down to is a quality of life issue. So that's kind of what we focused on the most in therapy, at least.
So when you talked to Dr. Larson and he said that this was kind of an unsung yet important symptom, status post mastectomy, how did he address this issue? Like, how does he normally approach something like this?
Yeah, so I don't want to speak for him, and he's so articulate with his words, but from what I understand, from what he's told me, is that, when we're focusing on cancer, it's like, let's get the cancer out, right? If you have a breast cancer diagnosis, that's the main concern. Most people are not concerned with sensation at that point. But a lot of the clients that I work with have not been maybe informed or even aware that sensation could be lost. And how he describes it is that when you go through mastectomy, there are options technically to regain that sensation that most clients aren't aware of. And I wasn't aware of either. But he talked a lot about, let's get the cancer out and then we could focus on quality of life issues after. So I love the fact that we both have different scopes. And when we came together to talk about it, we both had pretty different vantage points, but in a good way. We had the same goal. But when he described it, because I wanted to learn more, that's kind of how I learned of him. When he talked about breast neurotization surgery, I'm not a clinical expert on the procedure, but from what I know from what he's told me is that when breast tissue is removed post-mastectomy, the nerves that supply sensation to the chest are removed with that tissue. So this usually results in permanent numbness unless it is surgically repaired. And a lot of my clients did not know about procedures like that. So that's kind of what I've learned from him. And I could relay that to my clients, which has been a beautiful thing.
So after hearing from Dr. Larson's perspective and learning from it, so give us an example of how that's changed your counseling and talking to these patients, these clients.
Totally. Yeah, that's a really good question. So whenever clients come to me, again, depends on their goals for treatment, but for specifically the clients that are really concerned about the loss of sensation and how it affects their relationships, their quality of life, how they navigate the world, how they have a loss of identity. A lot of times we focus on the process part. I sometimes will add in, hey, why don't you talk with some other medical professionals? I'm learning. Again, I'm not an expert. I'm learning about these other procedures, and I think it would be worth getting curious about. So I feel like I have some more value to bring to my clients after talking with Dr. Larson. It's incredible. And a lot of times or at least what my clients have told me, when they're in this process of going through this really horrific experience, they just are so grateful to be alive. And I'm so grateful that they're alive too. And it's grateful that we could both share these moments post-surgery, and just be able to be in the same room together. But after time goes on, they're very much reminded of the impact physically, psychologically, and the sensation part I've noticed is one of the core parts of how we find meaning in life. Think about when you have a really deep conversation with a friend, not only do you feel it psychologically, but you almost feel that warm, fuzzy feeling. And I'm kind of generalizing here. So you really could connect with people based on sensation. So that's kind of what we talk about most of the time now.
Can you share a case study, and it could be a hypothetical case study, where you have moved the needle in one of your post-mastectomy clients in terms of helping them adjust and adapt to that diagnosis?
Sure. Yeah. Just for purposes, anonymity, and this isn't based on client data. So I've had several clients, but one in particular, she came to me post mastectomy, and her kids and her family, they were really concerned about her. She was very depressed, very low, feeling like, her chest had been almost like empty or deleted, and it was a part of identity for her. And I think something important to note that a lot of times people don't want to talk about these things because they feel like, oh, breast tissue is intimate in nature or sexual in nature. But for women particularly, or women who are assigned at birth, it is an identity for us, So, if you think about breastfeeding and stuff like that. So she came to me very depressed, very low. So we focused a lot on how do we engage in behavioral activation, a lot of the evidence-based treatments for depression for people who are experiencing low depression. And it just wasn't working. As a clinical psychologist, we always look at, what's working, what's not, measurement-based care. After a couple of weeks, we decided, hey, we have to change course. So we did a little bit of acceptance and commitment therapy, which is based on values work. We did that. We were starting to get somewhere, but there was something within me, Kevin, that it just didn't feel right. And I'm like, how are you feeling about your body after this? And she just broke down. And we just started to have conversations about sensation. And she's like, I feel so silly talking about it because I'm just cancer-free now, and I feel like I should be grateful. But that was the key moment where we started to pivot in a really positive direction, because she was saying to me, just being able to talk about the lack of sensation has been helpful. So that alone was helpful. And then after talking with Dr. Larson and doing my research and really just, again, talking with other medical professionals who are in this field, I've gained so much information that I could relay to her. So I did, I would be able to talk with my clients about this stuff. And it gives them hope. And as psychologists and any other mental health professional, people might disagree with me, but if we're able to maintain that installation of hope, that's the key for people, especially if they're in a really depressed state after cancer diagnosis, especially post-mastectomy.
We're talking to Kristen Casey. She's a clinical psychologist, and today's KevinMD article is titled, Patients with Chest Numbness Following Mastectomy May Experience Lower Quality of Life. Kristen, can you share some piece of advice for patients and their families who are unfortunately undergoing this relatively common procedure?
Yeah. It will look different for everyone, but I think reasonable expectation management is helpful. What is my life going to look like? What are my limitations? What are my strengths? And most importantly, what are the elements in my life that I have control over? Because I think for some people undergoing situations like this, especially with this procedure, they feel a great sense of lack of control in their life. So there are strategies available for mindfulness techniques, diaphragmatic breathing, really grounding yourself in the present moment. Even more important, Kevin, I think, is really looking at the grand scape of your life and saying, what am I looking for? Am I looking for connection? Am I looking for hope? And you could find that within therapy, with a therapist, for people who have the opportunity for that. Also, there might be research articles out there as well, but really the main thing is really looking at the options for lack of sensation with breast neurotization surgery. So.
And my final question, tell us some of your take-home messages that you want to leave with the KevinMD audience.
Big fan of the podcast, but one thing is never stop learning, never stop growing, and never stop being curious, because there's always more to learn, more to know. And if you really think about, if you're an expert in your field, like I consider myself an expert in psychology, I still have so much to learn and so much to know. It's just endless. So as long as you keep an open mind, you'll be able to help your patients.
Kristen, thank you so much for sharing your time and perspective. And thanks again for coming on the show.
Thank you so much.